Hello, everyone. Recently we see a surge in the number of cases of hand, foot, mouth disease in children. And this is something which is bothering each parent. And there are so many parents coming and asking me about this. So, today I've got with me a very renowned pediatrician from Pune, my friend, Dr. Rishikesh Damle, who will tell us about what this disease is about and how to prevent it and everything. So let's get talking with Dr. Rishikesh. Hi, Dr. Rishikesh. Uh,
Hello, good afternoon, Dr. Abhay.
Thank you.
Thank you for
So, can
inviting.
you tell our viewers what is this hand, foot, mouth disease and why are we seeing such a big surge of these cases recently?
Yeah. Hand, foot, mouth disease is a viral disease from the genus ge- Coxsackie virus. So the name of the virus is Coxsackie, and it typically presents with history of fever and rash. It starts with fever, cough, and cold, just like any other viral illness, and rash with typical distribution over hand, foot, and mouth ulcers. On hand and foot, typically it occurs over the palms and soles, over the buttocks, over the thighs, over the elbows. So this typical distribution of rash and fever is known as hand-foot-mouth disease, and we are getting sudden surge because epidemiologically it happens usually at the start of monsoon, and which coincides with the opening of the school.
Okay. Okay, so typically, is there any particular age group where we see this very commonly?
See, this hand foot mouth disease can happen in all the age groups, but what we see below the age of 5 years, it has shown more infectivity, it is more rampant, and it is more spreadable. So, below 5 years, it is more, but it can happen in adolescents as well as in adults.
Yeah, so Dr. Rishikesh, can you please tell us how does this disease spread?
Uh, Disease usually spreads in schools, daycare centers. It spreads exactly like a coronavirus, like cough droplets, then direct spread, direct contact with the infected patient, direct contact with the phone. If patient is sharing his utensils like plates, comb, towels, then it can spread through that from the cough and sneezes, the sneeze particles. It can spread this particular virus. So direct spread and cough droplet spread is known in hand foot
Okay.
mouth disease.
So this seems to be very, very contagious. So now tell
Yeah.
us about how can we prevent this spread of this disease?
Yeah. So just like COVID appropriate behaviors, we have to wear the mask. We have
Okay,
to wash our hand frequently. We
okay,
should avoid touching our eyes, nose, and mouth frequently, because if we touch the contaminated surface and we touch our own eyes and nose, it can spread. And you have to follow the cough etiquettes like applying handkerchief while coughing or
okay.
sneezing. So on the top of it, we need to isolate the patient. So home isolation
Okay.
for at least 7 days
Okay.
is essential. So home isolation following the cough etiquettes and all COVID appropriate behavior like wearing mask, washing hands can prevent this disease.
Okay. And is there any way in which we can actually establish a diagnosis? Is there any laboratory test or any parameter on the basis of which we say that this person is suffering from this disease?
Okay. By and large, this is a clinical diagnosis. So
Okay.
usually the lab tests are not required. Typical distribution of rash over hand, foot, and mouth, along with fever and these typical symptoms, usually clinches the diagnosis. But lab doctor diagnosis is possible for the research purposes. It can be taken. You can take a throat swab, or if there is a blister filled rash, then that fluid can be sent for for culture as well as for PCR for
Okay.
confirmation of enterovirus, that is Coxsackie virus.
Okay, so now there are a lot of parents who panic and who ask us whether this is a fatal kind of an illness, or so is there any kind of vaccine, any kind of specific medicine that you would recommend?
By and large, this is not a fatal disease. It's a self-limiting disease. So what do you mean by self-limiting this disease? It's without, with a basic treatment like taking rest, but drinking plenty of fluids, for fever, taking paracetamol. This much treatment is enough. Usually, antibiotics and any strong medications are not required. Currently, there is no vaccine which is available for Coxsackie virus. So prevention is mainly by following the COVID appropriate
Okay.
behaviors and home isolation. Currently, no vaccine is available for hand foot mouth.
Okay, thank you, Dr. Rishikesh, for this wonderful information. I'm sure that it is very reassuring to know that this can be prevented and we can take simple measures and have COVID appropriate behavior or those kind of things which we already know how to follow. And with the help of this, I'm sure that we can prevent the spread of this disease. I'm sure this information is very, very useful for
Yeah,
all.
one more point I want to add is, it can happen. It can happen that it is a recurrent disease.
Okay.
So every, monthly, 2 monthly, even yearly, it can repeat because there is no immune memory and there are lot many strains of enteroviruses.
Okay.
So just like COVID, just like dengue, this can, recurrently, can get infected. So in schools and in daycare centers, we have to be careful. Parents should not send their child with symptoms suggestive of hand foot mouth disease. So increasing the awareness about the
Yes.
disease is more important, and that's what we are doing with this live
Okay.
channel.
Yeah,
Thank
so
you.
I think this is very, very important because what I learned from all this is that this is preventable. We need to take simple measures, which is very much possible at home. And I think this also stresses the fact that we should try and improve the immunity of our children, trying to give them most natural food, and also trying to encourage them to do regular exercise, avoiding junk food, etc. I think this will go in a long term to help us prevent our children from such diseases. And I think just natural therapies are a wonderful way in which we can actually treat these kind of viral infections. Thank you very much, Dr. Rishikesh. Thank you so
Thank
much.
you. Thank you. Thank you.